Welcome back to another special mini episode of Cancer Buzz. The COVID-19 pandemic has affected every corner of American cancer care. Today we examine psychosocial services, how they've changed this year, and how to help your patients. Helping patients cope with uncertainty, anxiety, and stress is a critical service for patients with cancer. Our guest today says the rest of the world now understands the mental stress of the unknown felt every day by these patients. Dr. Jeff Kendall is the Director of Oncology Support Services at the University of Minnesota Medical Center.
One of the major changes that has occurred is most of our appointments, and this is across the country, are being done virtually. So we've been talking about virtual appointments probably for 15 years or more. No organization really ever took that leap. And then suddenly in March of this year, everybody had to take that leap.
So we can read a lot of statistics about the pandemic and the wider adaptation of telehealth actually being great for mental health practices. Are you seeing more of that from patients with cancer?
Very much so. The switch to telehealth has done a number of things. First, it's increased access to both urban and rural environments. People that could not get to the cancer center to meet with somebody now can, as long as they have the connective abilities. The other thing that it's also done is it's released burden from our cancer patients. Instead of driving into the cancer center, which in some rural parts of the country could be 2 hours away so they could see our psychologist or our social worker, now they can just sit in their living room and access us. So it has really helped cancer patients and increased access to this very important cancer care.
How about specifically what you're seeing them for? Are they adapting to the new normal, or what sort of challenges are they facing mentally? And then ultimately, of course, how can your colleagues across the country, cancer teams, help those patients in this time?
When you think about the COVID epidemic and the whole general population, the complaints that they're making are, we don't have any control over this. We're being told what to do, when to do, and how to do it. And what's very interesting is if you think about it, that's what cancer patients have been facing since the dawn of cancer, or at least obviously in the modern age, is they feel they don't have any control over the cancer. They're often given a whole list of appointments. You're going to be here at this time. And so for cancer patients, COVID has just added another layer for them. And obviously, the first layer of just having cancer was plenty. But then you add that second layer of COVID, and it makes it even harder for them.
How do you help them?
One of the things that a tool, if you will, if you want to get very specific on a hands-on tool, is I work with them on refocusing on the controllables, just like we do with cancer. So I can't control who's wearing a mask and who's not wearing a mask. I can't control what state is shutting down certain businesses and keeping other businesses open. I can't control how often other people wash their hands or keep their social distancing. But I can control if I wear a mask. I can control if I wash my hands, and I can control if I social distance. And that's what I help cancer patients focus on, just like we did with cancer. You can't control if it comes back or not. You can't control how the medications, the treatment medications affect your body. So you focus on the controllables. And cancer patients really, they like that. That gives them something to focus on.
What about long-term effects on mental health and on psychosocial care, the needs and the provision moving forward? Do you think that we can utilize what the pandemic has shined to light in terms of psychosocial care, specifically for patients with cancer, and really use that to our advantage to get patients their supplemental services that they need moving forward, make that more integrated in care systems?
I would certainly hope so, especially if you have cancer center administrators that are worried about the finances of providing psychosocial care. The pandemic would help them understand the uncertainty that cancer patients go through, the anxiety that they go through. So it almost brings it home to people that are questioning if this care is necessary because they've experienced it. I can tell you how I feel today, but I can't express to you the intensity. And now with the pandemic, everyone can understand a little better the intensity of the emotional experience of a cancer patient, feeling trapped at home. In some cases, not being able to work and the financial pressures and again, the anxiety and all of those things. So those things are more real to everyone following the pandemic. The other piece of this is kind of a repeat of what I've already said is we have now shown that virtual care can be done and is actually highly accessible. I know my clinical load has increased dramatically. The number of people that don't come to the appointment or cancel the appointment has dropped dramatically. So I'm busier. And again, for administrators that are worried about finances, well, you don't want a psychosocial professional that doesn't have a full clinical load. So the clinical loads are larger or filling the calendar in total. The patients like it better because they can access the care with greater ease. And then on top of it, people understand what they go through better.
More resources on navigating psychosocial care can be found in the show notes. On our next episode of Cancer Buzz, the role of caregivers and how cancer programs can support them during a pandemic. For the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.